Welcome guys again to my YouTube channel, Kunle23, and today we're going to talk about a very interesting topic. I call it early pregnancy symptoms. And over the past week, before I go on, if you haven't subscribed, please make sure you subscribe. As you subscribe, also watch the videos, like the videos, and share with someone. You can also put a comment if you think there's a video or there's a topic you want me to talk about that I haven't talked about yet. You can also drop a comment. Over the last week, I popped up a question on my social media and I asked people for their experiences in their early pregnancy period. And trust me, I was thrown back to some wild, good old days, man. Some experiences we had together with some patients in their times, and some were mild, some were moderate, some were severe. When I say severe, I mean really, really, really severe. And early pregnancy, usually in the first week to the 12th week, in the first trimester, it's a period where the body gets to adjust to a lot of hormonal differences. The hormones just go raging, and because the body has never been pregnant, or rather the body has never been pregnant with that pregnancy, the person reacts in different ways. And it's important to note that the way anti-A and anti-B will react to pregnancy is different, even though they are siblings, even though they could be twins. And also, it's important to know that the way you react to the first pregnancy is not the way you will react to the second pregnancy. Some first pregnancies are easy and enjoyable, while second pregnancies are very, very critical and very, very life-threatening too. So it's important to know that there are different things that can happen to you, whether the pregnancy, whether the person, whether the husband. If you change your husband, it can be different. If it's the same husband, it can be different. It's a whole lot of things goes into it, and the doctor cannot predict how the next pregnancy will be. No doctor can predict it. In fact, there was a time during my housemanship we were told not to even admit any labor case because the theater we were renovating it. So you can imagine how it is, because even as you cannot predict how the next pregnancy will be, you cannot predict the outcome of any labor. You cannot predict the outcome of any labor. Yeah, it's important. So let's get right into it. So when it comes to early pregnancy, what are the things you really see? It's early pregnancy. The first thing you really will notice in early pregnancy is absence period. Not to say that pregnancy is the only reason why you will miss your period, but of course, if you miss your period, the first thing you think of is pregnancy. So at that point, people tend to run to do blood tests, and then I've even seen people who say that, "Oh, doctor, I didn't know I was pregnant until I didn't have any symptom of pregnancy until I did the pregnancy test." More like pregnancy test was the awakening call. But then, yeah, it's usually like sometimes like that. At the point when you feel pregnant is at the point when you actually know that you are pregnant, because ignorance sometimes could be bliss in pregnancy. What causes you not to miss your period? It's a no-brainer. When there is implantation, the blood that's supposed to come out will now be the blood that will protect the baby and help the baby grow. Another thing you can experience in early pregnancy is also spotting. Some people, when they get pregnant, they spot. In fact, some people still see that spotting as their period. So they say, "Doctor, I saw my period, but I saw it for just one day. And after that one day, I didn't see my period again." Yeah. So that could be pregnancy. That could be spotting from an already established pregnancy. It normally occurs with some cramping in some people. The cramping is what makes you kind of think that you are seeing your period. When you have cramps, then you see small blood, now say, "Oh, my period is starting." Then the second day you put your pad, you don't see period again. Like, what happened to my period? Then after 2 weeks of not still seeing your period, now say, "Oh, let me go and do pregnancy test." Bozo. Then it's found out that you're pregnant. Usually what causes it? At the point when the fertilized egg attaches to the uterus, there's a little shedding and there's a little cramping, and that can be the reason why you are experiencing, why the person will experience the pain, the cramping, and the cramping and the spotting. Yeah, sorry. So another thing that can happen is there could be breast changes. In fact, I hear this a lot of times. Even people who had some complications in their early pregnancy and they suffered abortions, they still have this breast pain too. But the breast becomes fuller, becomes more tender. Some people might experience dark areola areas. Some people might experience bigger nipple areas. So those are changes that can really occur in early pregnancy. That's why some mothers can detect if their child is pregnant. If they know that this woman, maybe she's married, we expect her, and then she's not saying or forthcoming with information. By the time they look at her, those mothers, they will just look at one or two things. Usually is the breast. They look at the breast, they look at the skin color. They just say, this woman, are you pregnant? And usually, bozo, they get it right. So what causes it? When pregnancy comes, there's increased level of progesterone, there's increased level of estrogen, and these are the things that usually causes those changes in that we see in the breast, especially. Another important thing that we see all the time is fatigue. Some women's early pregnancy is equal to fatigue. Like when they are pregnant, they expect that fatigue comes in. Fatigue, they become so weak, they can't concentrate on many things, usually because the pregnancy has started kicking in, because progesterone pushes on. In fact, the role of progesterone in early pregnancy cannot be overemphasized, because that's the major hormone that holds the pregnancy in place. And then as the pregnancy increases in the first trimester, progesterone level increases just to hold the pregnancy in place. And when progesterone level increases, the body is not used to progesterone level increasing. The body starts to fight, the body starts to give you a lot of bad boost, and that's what usually causes the problem. Also, my favorite part, nausea and vomiting. Nausea and vomiting is a hallmark of early pregnancy. I can't count how many women I've seen. In fact, if you're a woman and when you get pregnant, you don't have nausea and vomiting, congratulations to you, because statistics show that more than 90% of women in their early pregnancy will have nausea and vomiting. Sometimes the nausea can come without vomiting. Sometimes nausea comes with extreme vomiting. When I say vomiting, I mean a hyperemesis gravidarum, whereby there is dilapidating state, there's weight loss, inability to eat. Usually they come together, inability to eat, called anorexia, nausea, vomiting. Anorexia is inability to eat or fear of eating. Nausea because you just start to smell things from far away and that it irritates you. Some women stop using perfume. Some women stop using body cream. They ban their husband from using perfume. They ban their husband from using body cream because, man, once they smell it, they just want to vomit. Some women is early morning vomiting. Every morning when they go to brush, I hear it a lot, doctor. Every morning when I go to brush, I always vomit. Every morning when I go to brush, I always vomit. That's part of what nausea and vomiting is. Some people also have nausea and vomiting to the extent that they are hospitalized. Frequent hospital admission. I've got patients who, once we discharge her today and she gets home, once the effect of the drips and injection wears off, within a few hours she's back to the hospital. And I met someone, I know someone who was admitted 13 times in the first trimester. Can't beat that. And she gets better, she goes home. In the evening she's back, gets better, she goes home. And I know somebody who was on admission throughout her first trimester, throughout. These are the things we see. I'm going to attach screenshots to my Instagram post so you guys can see some of the things people were saying. Someone even had to leave her job, because it was draining, And what's the cause? When there's this hormone called beta HCG, that's the pregnancy hormone. When that level increases and then estrogen too increases, everything just scatters in the digestive system. Digestive system just goes gaga. there's a lot of vomiting, there's a lot of nausea. Another thing that happens is frequent urination. When a woman is pregnant, the bladder is in front, the womb is at the back. So when there is irritation in the womb and the womb gets a bit bigger, it starts getting bigger. It starts putting some pressure on the bladder in front. So when that pressure applies on the bladder wants to empty. So that's why there usually is frequent urination in people who are pregnant. Any small thing, they want to urinate, any small thing, because once the bladder is being pushed by the womb from behind, they want to empty the content of the bladder. Other things can happen. This one is even very funny. Mood swings. I met a couple sometimes when they got married, when I was in clinical practice. I met a couple, and a month after their wedding, was it a month after their wedding? I think it was a few weeks after their wedding, the wife discovered she was pregnant. And because she was pregnant, she had mood swings. And then the man was really shocked, like, come, is this the woman I married? Was this woman hiding her character all this while? Why is she doing like this? When they go to the hospital, I had to sit him down and give him a proper lecture on how mood swings can affect their marriage. Because she's pregnant, so I have to give him a proper lecture on how to handle it. Guy, just calm down. Just know that it is pregnancy. It is nothing else, It was so bad at that point, and I'm sure a lot of people experience this mood swing too, because it's also a very, very common symptom. Another common symptom, food aversions or cravings. Some days ago, a friend reached out to me whose wife is pregnant for their first child, and he said she wants to eat rice and okra. I say yes. Get her rice and okra. Say another day she said she wants to eat roasted corn and salt or something. I say, my brother, this is pregnancy. Early pregnancy, there could be cravings. Not everybody has these cravings. If your wife gets pregnant and she doesn't have cravings, congratulations to you, because it is not usual. Usually, many pregnant women have cravings in their first trimester, as their early pregnancy symptoms. So he reached out to me and say his wife is craving this, craving that. I say, you know what, you just gotta get it for her, But I tell my pregnant women, you are pregnant, but you are not sick. If you have cravings, satisfy your cravings moderately. Because you want to take Coke doesn't mean you not take Coke 3 times a day. Because you want to take malt doesn't mean you not take malt 3 times a day. Because you want to take pepper soup doesn't mean pepper soup will not be your staple food. No. Satisfy your craving, but please apply a lot of moderacy. Bloating is another symptom that we see. I mean, in fact, we see this series a lot, And I just, when I hear that, oh, doctor, I can't eat. If I eat little food, I'm satisfied. I'm like, okay, it's your pregnancy. Sorry. So most times, just give them some antacid. Antacid really can help with the bloating, expel some gas and then make them a bit better. Expel some gas and make them a bit better. Because I keep telling my patients, as long as the pregnancy is still there, the symptoms will still be there. I'll get to that point at the end of this video. I'll get to that point. Another thing you can notice is an increased body temperature. I've seen men come to the hospital with their wives for antenatal care and say, doctor, I noticed that at night her body will be hot. So I noticed that her body will be hot. I say, yes, her body is hot because she's pregnant. It is not a problem. I mean, the difference is because when you are used to sleeping on the same bed with your wife over the months, over the years, and you know how the body feels when you guys cuddle or hold her, then when she's pregnant, a few weeks into pregnancy, you've touched her, she's a bit warmer, she's a bit warmer than what is there. It usually will raise some concern, because when people see fever here, they think malaria, and they say, oh, malaria in pregnancy is bad. So yeah, so they think, and I say, okay, calm down. It's not malaria, especially when there's fever, when there's elevated basal temperature, as this warmth I'm talking about, when there's nausea, when there's vomiting, when there's loss of appetite, when there's headache, people just say it's malaria. Let's go and treat malaria in this pregnancy. No, don't rush and treat that malaria. Calm down. Another thing that we usually see is dizziness, lightheadedness, and also constipation. Dizziness, lightheadedness, yeah. I see that a lot, say, oh doctor, I feel suddenly dizzy. I mean, that's okay. I mean, it's not bad, because when you get pregnant, blood pressure can drop. When blood pressure drops, it could give you some dizziness, give you some lightheadedness, just spending the time when body adjusts to this new situation you are in for the first 12 weeks of your pregnancy. Constipation, the same factor yeah, that drives nausea, vomiting, is also the same factor that drives constipation, because the GIT tract just takes a hit from pregnancy, and then having to empty the stomach from the stomach to the small intestine becomes a bit slower. Then the person starts to get that symptom. Also, I've seen a number of women say, oh doctor, I perceive metallic taste in my mouth. Yes, I mean, it's still part of these hormonal changes. Metallic taste can actually occur in the mouth, when you are in your early pregnancy, and as I hear that a lot. Some people go as far as eating cola, yeah, not cola nut, no, actually cola nut or whatever. So people go start eating funny things. Some people go start eating so many funny things just to reduce that metallic taste, and see it a lot. Also, one very important thing I haven't mentioned is excessive salivation. Yes, some women go as high as carrying containers of spit. They'll be spitting into containers. It's not their fault, really. It's just that nausea increases the salivation that is being produced, and they have to spit it out, because if they take it in, it's going to induce vomit. It's most likely will induce vomiting, so they need to bring it out. So most times women chew, lick tom. Some people go as eating sand. There's this sand they eat back home, and when I see it, I cringe. Why are people eating this thing? They say, doctor, it's for this nausea. I say, people still go as far as eating all those things to subdue this nausea. Some people also have vaginal discharges. I've seen a case where a woman said, oh doctor, before I got pregnant, I wasn't having vaginal discharge this much, but after this discharge, I started having this milky white discharge. Is it candidiasis in pregnancy? Is this sexually transmitted infection in pregnancy? I say, no, it is not. It's none of the above. It is just because you are pregnant in your first trimester. Just calm down, keep it low. Don't bring trouble into your mind, because when all these things start coming up, pregnant women try to, a lot of problems come into their head. They tend to get into a lot of thinking zones, think of the worst, because I don't blame them. Nobody wants their baby to be hurt. And those thoughts are really valid. But one thing that you must take away is that whatever symptom you see in pregnancy, your doctor must be able to validate it. Your doctor or your midwife must be able to validate whatever thoughts you have in pregnancy. Don't just think this is it and just throw it away. No, don't go to Google and start looking for symptoms. No. Whatever symptom you feel, let your doctor or midwife validate it. Make sure you go for testing if you have fever, if you have nausea, if you have vomiting. Once pregnancy is established, make sure you go and test if you have malaria, if those symptoms persist, even after your doctor has given you some medications to suppress them. And when you have vaginal discharges, don't just gloss over it. Oh, it's because Dr. K has said because I'm pregnant. No, still get to the hospital. Let the doctor be the one to validate whatever you are feeling in your body, to say this is what it is. This video is just for you to stay updated and stay very, very educated. As I said, pregnancy is not a one size fits all. Varies from person to person. The way Taye feels it, different from the way Kehinde feels it. The way you felt it for your first pregnancy, different from the way you felt it for your second pregnancy. You must always submit yourself to medical checkup. Go to the hospital. And then husbands. I got a lot of review from some husbands, which were very, very interesting to read, about how they too were very involved in the very process of pregnancy from the beginning to the end, especially in the first trimester. And it was quite encouraging. It was quite encouraging to read. And it's important that women who get pregnant get as much support as possible, because they do have no control over the changes that is happening in their body. So they need support from their husbands, they need support from their family, they need support from their friends. Please let us support one another. If you found this video very informative and very useful, please make sure you like it, make sure you share with somebody who also will benefit from it, and make sure you put something down in the comment section. Till I come your way again, have a blessed time. Bye.